for IBS and gut-related symptoms. Hypnosis has been shown to be an effective treatment for irritable bowel syndrome in a number of clinical studies. And it's been known in the studies, they found that hypnotherapy for IBS involves progressive relaxation, which is easy to do. Well, for the hypnotherapist, it's easy to do. And then suggestions of soothing imagery and sensation focus on individual symptoms, which again, it's easy to do for the right hypnotherapist, which is me and Randy. All right. Now, other study has shown that around 70% of people reduce their gut-related symptoms after 6 weeks of gut-directed hypnotherapy. Now, that is a big deal, if you ask me. It's a big deal. There is a significant research that shows gut-directed hypnotherapy is effective and results are long-lasting. How many people have gut issues? Are there people that don't have gut issues? Well, not huge gut issues, but I think everybody has acid reflux or some sort of form, especially with the anxiety that we develop over the pandemic. Now, Peter Horwell, a pioneering gastroenterologist at the University of Manchester, introduced the first scripted hypnotherapy protocol for IBS patients in 1984. 1984, so it's a lot of study done about it. And there were multiple well-controlled studies, including at Monash University, that show that gut-directed hypnotherapy improves gastrointestinal symptoms, which are many, just many. Gastrointestinal symptoms in people with gut-related issues, about 70 to 80%. 70 to 80%, that's a big deal. And these improvements are maintained in the long term. Maintained long term, yeah, no drugs. So this is a big deal. Now, gut-directed hypnotherapy has been linked to improved function in the gastrointestinal tract and may operate through immune-mediated pathways in chronic disease. Let me say this again. Gut-directed hypnotherapy has been linked to improved function in a gastrointestinal tract, gut, and may operate through immune-mediated pathways in chronic disease. Now, that's a big deal to be able to use hypnotherapy to get an immune-mediated response in the physical body. Wow. So there's very, very few people that know about it, but there's also a good number of people that have asked me if hypnotherapy can be used for other than smoking and weight loss. Well, hypnosis started, it began to be used for IBS type of a thing and gut-related and chronic pain and other issues other than smoking and IBS. So I don't know how it became popular that hypnosis is effective. It's used only for smoking and IBS somehow. Well, I have an idea, but I talked about it before. I'm not going to talk about it again. But yes, hypnotherapy, it's well researched and well studied that it's an excellent treatment for illnesses. Chronic pain is another one, and it's not only cancer patients that use hypnotherapy for chronic pain. I had quite a large number of clients that suffer from chronic pain, and I was told that if their pain is normally at an 8, from 1 to 10, at an 8 throughout the day, I was able to, well, they were able through the hypnotherapy I provided to have their pain reduced to about 2 or 3. Now, that's a big deal. again, that's a big deal. But Randy has something to tell us about hypnotherapy for IBS. He has a story for us. So, Randy?
Yeah, I was just happened to be listening to NPR, and all of a sudden, just out of the blue, this came on the story about um, how a secret therapy had helped this man deal with IBS, irritable bowel syndrome. And it wasn't a secret therapy; they called it a surprise therapy. And they said it was hypnotherapy had helped. It was a surprise to him, and a surprise alternative. So it was a story. It wasn't a long story; it was like 6 minutes long. But it interviewed this man who had suffered with IBS for many, many years, and he had gone to many doctors, taken a lot of medicines, the route a lot of people are very familiar with, and he was directed at some point. I'm trying to remember how he got in touch with it, but at some point he was educated on the possibility of hypnotherapy being an alternative, or really not an alternative, but I can't think of the word, Carmen, an addition, but not supplement, but a complement to his medical treatment. So he went through several sessions of hypnotherapy. The story talked to his hypnotherapist. He was referred to a psychologist who does, I wrote it down, but it's gastrointestinal based hypnotherapy. I had never heard of that specialty, so was another thing that was new to me. But that's all that the psychologist did, was hypnotherapy for gastrointestinal illnesses. And she worked with him, I think it was about 6 sessions, and he said it totally changed his life. Before then, he was becoming very reclusive because it was just not worth the hassle trying to go out, because the first thing he did when he shut the door was thinking about where he could find a bathroom. And everywhere he went, the first thing he did was, where can I find a bathroom? Where's the bathroom? Where's the local bathroom? How do I get to one the quickest? And it was just so much stress. And they didn't get into exactly what the hypnotherapy addressed with him, but they talked about how IBS is one of those conditions, as is most physical conditions, some people say, that is very sensitive towards stress. So that if there's and stress with this is a vicious cycle, because if I have IBS and I want to go to a museum, I start stressing out about it. Stress makes the IBS symptoms appear. Then I stress because I have the IBM symptoms, which makes the symptoms worse, which makes my stress worse, et cetera, et cetera. So it becomes a very vicious cycle. Through learning how to relax and to purposefully, mindfully, consciously, deliberately, programmatically relax himself, and to address the stress symptoms as they appear, not when they're at a level 8 or 9, then he was able to, he wasn't cured of it, but he was able to live and manage his symptoms. And he said it turned his life around, and he wished he had known about hypnotherapy 25 years ago. So I thought it was a very interesting story. I didn't know that there was that subspecialty of hypnotherapy that dealt only with gastrointestinal diseases. It was very interesting, which just goes to show, if there's professionals who are doing that exclusively, then hypnotherapy's got to be effective. And I think it's, and so, and reading, doing some of this other reading I've been doing lately, what illness isn't affected by stress, and what disease isn't impacted by stress, and what disease doesn't impact stress, and what disease is not impacted by stress. So, dealing with that kind of thing can do a lot of good. And I do want to put a disclaimer, and I was thinking about this earlier. that just to make sure it's clear, hypnotherapy, as Carmen knows very well, hypnotherapy does not cure things like IBS. It doesn't cure cancer. It doesn't cure anything. It is not a cure. So this man did not get his IBS cured by, and I'm reading a book now that talks about these miracle cures from people that have had alternative treatments. But, you know, Steve Jobs went to an alternative treatment for his pancreatic cancer, and it killed him like in a year. And he could have lived several more years if he'd just gone through regular treatment. But, you know, to each his own. But anyway, we'll have to be very, very careful about this. But in conjunction with medical treatment, in conjunction with the medical treatment world, then hypnotherapy is a wonderful adjunct. I think that's the word I was looking for, adjunct therapy to traditional medical therapy. And that was what I thought was really interesting. And then Carmen looked up a bunch of studies, and turns out that this is all a new world to me. I didn't know that there was that much professional, you know, I just didn't know it was that active a subspecialty in the hypnotherapy world. Is very exciting.
Yes, and in addition to the studies, I think it would be appropriate for me to disclose that I have been diagnosed with IBS, and 20 some years ago, 2001, I think I started hypnotherapy, and I had a lot of hypnotherapy sessions, and definitely helped with IBS. And like you said, is there a condition, medical condition, that it's not affected by stress? I doubt it. Everybody is affected by stress nowadays, and only if all we do is progressive relaxation, we are still doing a lot of good to help the body regenerate. But there is more happens during a hypnotherapy session other than progressive relaxation. And it's interesting to find these studies. I mean, I had my own studies on my own, and I've seen the results that it gets out of my own body. But to see that it's been out there since way before civilization, this is happening. But even this doctor that introduces gut hypnotherapy since 1984, it's quite something. And I've known all along, and partly the reason that hypnosis worked for me so well, and it helped manage and reduce the symptoms to maybe zero. Most of the time, in conjunction with a proper diet. When you have gut-related disorders, the foods we eat, there's going to be interaction. I mean, the gut is a very complex. It's a very complex system made of millions of good bacteria and bad bacteria, and it's very complex. I remember a doctor telling me that if just the gut, which it starts at the mouth and all of the intestines in the stomach and up until the end, that's the gut. If the gut were to have a heart, it would be an organism of its own. Now that is very complex. That is extremely complex. So yes, hypnotherapy definitely helps with IBS. And there is something you addressed that now it's at the tip of my tongue, something you mentioned. But before I get there, alternative medicine, when people have disorders, difficulty with their health, and their body is not working as it should and causes a lot of symptoms, alternative medicine, the right kind of alternative medicine, it's good. But a lot of people promising you that something is a miracle and something will help you, or a lot of herbs, or we ought to be cautioned with that, because I'm a believer in alternative medicine. I've practiced a lot of it. I've made use of a lot of alternative medicine, but not all the alternative medicine is going to be good for you, or because it might interact with a lot of these, and it might give you different symptoms that you think are might be related to something other. But the thing is that, well, now some of the studies are available. So if there is a supplement and a vitamin is going to help your condition, if there is studies done on that, that ought to be done with the doctor's supervision. So we're not doctors here. We're not giving you medical advice. I'm just, have a lot of experience and wisdom on that, and advices the doctors have given me. But when it comes to regenerative medicine, there's a bunch of people out there, very famous people, that claim that they found the regenerative solution to their physical body. And one of this is Tony Robbins. And I strongly disagree with that statement, because I took the statement and I've done research on that. And I also asked the doctors that, and what Tony Robbins was talking about, joint, regenerating your joints, because he has shoulder and his hand, he has joint issues. And he's claiming that through a particular doctor, he's found the this upsets me, and I'm not finding the right words now. So I've done my own research, and turns out that this doctor that he's worked with and recommending was convicted for murdering his wife. So we ought to do our own homework when somebody is making claims, such tremendous claims. Not only that, but I asked medical doctors, spine orthopedist, his specialty was orthopedic spine surgeon, and he told me directly that that research does exist and still has a long way to go. But the thing about joints and cartilage, the cartilage, they don't have blood supply. And any treatment needs the blood supply to take the medicine to that location. Well, most of them, right? So if the cartilage doesn't have blood supply to transfer the medicine, then how are you going to regenerate that? So it's, of course, it's complex, and maybe it is possible, and maybe it's going to be possible down the road, but there's a lot of complexity. So if somebody is promising you regenerative therapy, or go ask a few doctors, see what's available to you. But just buying a book that is going to promise you forever youth, I don't know. Okay, but going back to IBS, it's understandable. There is IBS with constipation and IBS with diarrhea. And when someone has IBS with diarrhea, it's instinctual that they need to be close to a bathroom, in a short distance within a bathroom. So it's very difficult for them to go places. And of course, they're going to be nervous, because what IBS does, it creates a lot of spasms in the intestines. And these spasms are painful. And then certain foods will trigger the more spasms, and it is more painful. And then in a case of IBS with diarrhea, the more spasm you have, the colon is going to move, and then you have to eliminate. So of course they need to be close to a bathroom. So it makes it very, very difficult. On the other hand, IBS with constipation, the type of spasm that they have, it makes it so that the content of the columns are not the colon are not moving so to exit. Both situations, they have irregular type of a spasm, but each different. So what I've learned through a lot of doctors, that also the mucosa of the intestines begins to be troubled, so to speak, and it could use help. And there are things that can help, and it's definitely an herbal supplement that is recommended by doctor that has been studied on that helps with regenerating the mucosa. And when the mucosa in the intestines begins to have troubles and begins to thin and lose its consistency, a lot of issues develop from there. Why? Because something like what's it called? Gut permeability happens, like leaky gut. A lot of people are familiar with leaky gut. And what that means is that the contents of the intestines permeate, that go through the mucosa and through the intestines, and part of it leaks in the system. It's like, imagine you having your plumbing leaking water. So this is what happens inside the body. So in the colon has good bacteria too, but it has a lot of toxicity that we're eliminating. So having all that re-enter the body through the leakage of the gut, that causes a whole constellation of symptoms, and that is something very hard to diagnose. So in this situation, good diet, it's very, very important. The proper diet that helps with probiotics and prebiotics, and also with the regeneration, and at least not damaging more of the mucosa, and foods that do not create a lot of gas. Because if you have too much gas in the intestine, then the intestine are not going to move, and then it pushes up, and then you begin to have GERD on top of that. So foods are very important, the type of foods that we eat. So hypnotherapy helps with that additionally, because when people have a lot of dealing with IBS or Crohn's or ulcerative colitis and even GERD and all gut issues, it's not life-threatening, but it makes life miserable, and it makes it difficult to do what you need to do. And I'm not talking about entertainment and go eat out all the time, because these people, they don't like to eat out. Because when they eat out, they have symptoms and they're tired of these symptoms. So if you're in the presence of someone that says, no, thank you, I'm not going to have that food, then let them be. They're not going to have that food because they know what's going on inside their body. So hypnotherapy, it's also going to help not only with relaxation, but have you direct your attention, so to speak, to what's needed. Because when you're overwhelmed with all of the symptoms, it's easy to lose track of what needs to be done. So hypnotherapy helps you direct your attention to what you need to do to make it better. And to have only 6 weeks, and we don't know in those weeks if the therapy was done once a week or twice a week or how many weeks, but within 6 weeks to have the IBS diminish tremendously, that's wow. And that I've experienced that myself. Then this was how many years ago. And I was symptom-free up until I was under a lot of stress, or I would eat something that completely disagreed. So soon after that would happen, if I would had symptoms again, I knew what to do. And the same happens with any IBS person. Well, given that they had enough of symptoms and they really want to do something about it, because people that don't want to do anything about it, I don't know how much, there's a lot to be said about that. So, their hypnosis, it's good, and it helps so many different things, not just smoking. Randy?
Well, I think you make a very, very, very good point, because you say that people who want to do something about it, and distinguished as people who don't. Usually, if somebody's willing to pay $75 to $150 to go see a hypnotherapist for something, thank goodness they're typically motivated. Thank goodness, but not everyone. And the point that you're making is, I mean, to add on to that point, is, yeah, you ask somebody with irritable bowel syndrome, or GERD, or any of those other things like you were talking about. Well, would you like to feel better? Well, of course. They're gonna say, of course I would. What? That's a stupid question. Blah 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 blah. Of course I want to get better, but do they really want to get that for hypnotherapy to work, and their medicine to work, and their doctor's advice? They have to, as you said, Carmen, change their lifestyle. They have to change what they eat. They have to practice the relaxation drills. They have to do a lot of things. It's not just going to a hypnotherapist 1 hour a week, or 2 hours a week, or
But the good
5
thing,
hours.
let me interject here. The good thing with hypnosis is that the right hypnotherapist will record the guided session and then make it available, and then you can practice that with headphones, of course. Again, when you don't drive, when you're at home and safe, and even listen to it before you go to sleep, and just let it play in the background, because your brain hears it even if you don't hear it. So, I mean, your subconscious will hear it even if you don't hear it. So the good thing about it is that you have a few sessions that are recorded, and you can use it again and again and again. And that's what I've done with my hypnotherapy. And I have had many different kinds of hypnotherapy targeted for different issues, and different styles of hypnotherapy. And what it brought to me, it was so good that now I decided to do this full time, because it's so powerful, and it enriches lives.
Yeah, so it has to. It wasn't. That was one of the disadvantages of hearing a news story about somebody. It's like, well, he went to a hypnotherapist and got this surprise miracle cure, and he's fixed. I guarantee you 100%, 111% that this is, it was more to it than just that. And one of the things I thought was interesting too in the story that made sense is when he emphasized it taught him how to relax better. And I went to a workshop a couple of weeks ago by this hypnotherapist, and he's very good. He's very interesting. And he said he says relaxation is very progressive relaxation specifically is very underrated. That it's kind of done. Some people think of it as the poor man's version of hypnotherapy. It's not real hypnotherapy, because it's progressive relaxation. He said, in his experience, if hypnotherapists, if all they did was progressive muscle relaxation, that was it. That'd be all they did. He said 80% of his clients would get better anyway. It's not, hypnotherapy is not this deep-seated going into the deep, deep, dark areas of the mind and digging things out stuff. It can be, but he was very much supporting this kind of thing, that just learning to relax in a very specific way, taught by a professional, and like you said, Carmen, following the listening to the personal and curated session that's made just for that person, self-hypnosis, then it can be, the way I think of it myself is, the way I tell people that I introduce to hypnosis is like a little small acorn. And that acorn, if you, or seed, let's say a seed, put the seed in the ground, or the acorn in the ground, And it could grow, it may grow, may not grow. It's probably, if the ground's not well, not good, it's fertile, it's probably not going to grow very well. But if a person wants that plant to grow well, if it's a sunflower seed or something, which I love, then the soil needs to be fertilized, it needs to be watered, it needs to be turned, it needs to be protected from the elements. In other words, it needs some tender, loving care, and that will make a very beautiful sunflower. Hypnosis and hypnotherapy is the same way. You can go to a hypnotist and get hypnotherapy on irritable bowel syndrome and then do nothing about it the rest of the week. And like a little sunflower seed, you may grow, you may not. If you water it and fertilize it, which is listening to the tapes, listening to your self-hypnosis, your, what's the word? Specially made, custom made sessions, listening to those 2-3 times a day, following the directions, then you're going to have a beautiful sunflower. So it's kind of the way I thought of it myself. But I was really interesting that the idea of relaxation was so profoundly important. I thought it was interesting.
Of course it is important. Of course it is important. And it's not, I mean, a lot of people think that relaxation is like plopping on a couch, on a sofa and watching TV. That's not it, because you relax a little bit because you're not involved with a lot of activities, but it's well known that just relaxation and just deep breathing, it activates your parasympathetic nervous system. So what does that mean? Well, when your parasympathetic nervous system is activated, any conditions like IBS and GERD and so many other that are affected by stress, they're going to be relieved. To what degree, we don't know. It depends from the individual to an individual. And are you relaxing for 2 minutes or are you relaxing for 20 minutes? It makes a difference. And it's not just relaxation, because through progressive relaxation and hypnosis, it's also well known that the brain releases the good neurotransmitters, the yummy neurotransmitters, serotonin, endorphins, dopamine, oxytocins. And the more of those neurotransmitters you have deployed in your body, the better. You want to have that, right? I mean, they made so much. How many different types of prescription medicine do they make based on this neurotransmitters? So it is very important. And I just found over here some other article that says that in 1994, a study at the University of Alabama found that participants who received a relaxation training, I mean, you're right, Randy, a lot of people don't know how to relax. And that's understandable nowadays, but learning how to relax, I mean, to really, really relax, not just flop and watch TV, that's not complete relaxation. So this participant who received relaxation training actually had less stomach acid, and it's about GERD now, gastroesophageal reflux disease. So they had less stomach acid moving up to the esophagus, causing acid reflux. And a lot of people don't know that the stomach is equipped to handle the stomach acid, but the esophagus is not equipped. It doesn't have the mucosa, the lining of all of the tissue and the mucosa necessary to handle the acid reflux. So when acid enters your esophagus, it corrodes it. So again, think of a plumbing that is all corroded and it leaks, and it causes a lot of issues. So only by having that acid reflux come up in your esophagus, it can make you feel as you have a heart attack. It is ugly and it is miserable. Right. So again, a proper diet is going to help with that. And definitely hypnosis is definitely going to help with that. And then here it says that other studies have shown that as well as promoting deep relaxation, hypnosis can have many physical health benefits, helping people have more control over their bodily processes. Control over the bodily processes. Yes, to a large degree, we can control what happens in our body. And yes, there's a lot of automatism that happens in our body. We don't direct the flow of blood, and we don't direct the heartbeat, and we don't direct the blood through the kidneys to be cleansed and all that. But to a large degree, we have control over how we treat our body, what we do to our body, what we eat, what we drink, what do we expose ourselves to? Are we around people that influences us negatively? Like, if you have IBS or GERD, you need to follow a cleaner diet because it's going to help you. So your esophagus is not going to get corroded, and you're going to heal quicker as opposed to somebody else. And when it comes to acid reflux, medicine has figured out a lot of treatments as to reduce the amount of acid. And it's true that it protects the esophagus, yeah. But if you don't have enough acid in the stomach, the food doesn't get digested. The food doesn't get digested, creates a lot of gas and a lot of other issues. And then you get all bloated, very uncomfortable. And then you're still going to have contents coming up the esophagus. So taking proton pump inhibitors, that's not solving the issue, which means you can continue to eat whatever you want. And I don't think it's worth the symptoms to go eat whatever if it's going to cause symptoms. And when it comes to GERD, there are some foods that they affect the strength of the sphincter, of the lower esophageal sphincter. So if a sphincter is supposed to be tight, so contents don't come up, they lower the strength and the sphincters opens, and then things just flow up the esophagus. So if we know which foods have a tendency to lower the strength of the sphincter, maybe we have less of these foods. Yeah, like coffee, it's one of the cigarettes, definitely. Yeah, chocolate, spicy foods, citrusy foods, right? So it's not like you're not going to have them never, but have them in moderation. And instead of 3 or 4 cups of coffee a day, maybe have just 1 cup, yeah, and have it with food. So the reason we would have and a lot of medicine that are recommended to be taken with food, so not to cause a stomach upset. And only stress, it will cause a stomach upset. And stress alone, it will cause this lower esophageal sphincter strength to lessen and have contents come up. And in my experience, it is not worth all of the troubles and all of the pain and discomfort. It's not worth that cigarette and that food that causes symptoms. And it's not worth pretending that this doesn't happen and this doesn't bother you. Oh, alcohol, I forgot to say alcohol. I forgot alcohol exists. It's definitely going to cause problems. So all of this, it's not worth you keep hanging on with people that expect you to eat and drink, and then you feel bad, and then you have peer pressure, and then go ahead and go out, but you don't have to eat and drink like they do. You can still have the camaraderie and socialize, but not eating and drinking like they do. And I remember that's what I did. That's what I still do. And it was, at the beginning, it was a bit difficult to tell them why do they eat like that, and why am I different? I like being different. So I would just say food allergies. And people understand food allergies. You don't have to explain gastroesophageal and IBS, and then this happens, and if I eat this, that happens. Nobody's going to listen to that because they're going to go, oh, what? Somebody that knows is going to go, oh, good for you. But did you say, oh, food allergies? I don't, because more people are familiar with food allergy as an anaphylactic shock, which you don't want to have, right? Anaphylactic shock means you stop breathing. Mm-hmm. So people are familiar with that, and then it's just, you get a clean slate on that, and you don't have to explain yourself. Because a lot of people, it's like they have enough of bothering inside their body, and they don't want to talk about it. It's like, oh, I want to take my mind off of it. So it's the thing, it's like, no, food allergy, that's not for me. I need to stay away from it, but I'll be happy. I'm here with your company. I'm enjoying your company. Let's have a good chit chat. And that little sentence over there just makes a little miracle in your interaction, and you continue to enjoy your group of friends and taking the pressure off of you. Randy?
Yeah, I think and the idea that, like you were saying, just to reiterate what you were saying, is that we may convince ourselves that we know how to relax, but hypnotherapy and progressive muscle relaxation can teach us how to do it even more, even if we do know how to relax some. What we think of as relaxed frequently isn't as relaxed as we need to be, as we can be. When I was having the surgery on my face, I knew they were going to stick needles in me, and of course they told me, and they were ugly looking needles, scary looking, but I mean, just a little long needles. And I remember telling myself, as they got prepared to start, okay, just relax. And I consciously did some very brief progressive muscle relaxation, not formally, but just relaxing the muscles I was aware of and relaxing them. And I thought I was 100% relaxed. And when they started prepping me and the needles went in the hands, I brought my attention back to it, and my shoulders were back up. The upper part of my chest was tense because it was in my face, and I know my neck was. It all just happened just like that, and that's our unconscious trying to protect ourselves, because we think our unconscious thinks we're about to be hurt, so it's going to get it ready. So I had to again be very, very aware of it, and hypnotherapy can help somebody become very aware of it and practice it and use it. I know that there's several types of relaxation besides progressive muscle relaxation, but there's also a type of relaxation protocol called autogenic relaxation, which is from the 1920s, and it was from a neurologist who realized that some people, when they get relaxed, they feel heavy, and their hands get warm, their arms get warm, and they get very heavy, and they feel smooth. They feel like their muscles are smoothed out. And this is another protocol. And I had a psychologist teach me that, and he was saying this was like something I could carry in my pocket. I hope I didn't mention this before, but he said he uses it all the time. He said what he'll find is you may find that when you're at the bank, or more often these days at the grocery store, or waiting in line at the gas station or something, you purposely go to the longest line, not the shortest, but the longest, because you'll have a chance to practice this beautiful feeling of relaxation. And when you're at a stoplight and it's taken forever, it's taken 3 minutes, which is going forever, you have a chance to practice this relaxation again. So a person looks for those opportunities that otherwise we would avoid, because it means we can practice it. So very interesting. It's very interesting stuff.
It is, yeah. And that's also called autogenic training. Because you're right, as long as we have, when something bothers us, something hurts, that's instinctually we're gonna tense up, and because that's the survival mechanism, that's the protection mechanism that says, oh, I need to I need to defend myself. I need to do something about it. And it's a good response, because it tells you, yes, you do need to do something about it, but staying tense like this, that's not the solution. So as long as you find yourself, and a lot of people are so used to being tense that they don't know that they're tense anymore. And if somebody might tell and say, "Oh, you look tense." Like, what do you mean? No, I don't look tense. No,
it's not a good place to be when they're about to stick a needle in you, because then they've got to stick it in harder. So yeah.
So it's important to know that we can do so much to help our own body, and to understand that our own body is beautiful and unique, and it has its own unique metabolism. And like, I grew up in Romania, and when I get together with Romanians, I got to eat the Romanian food. And some of the Romanian food is like, no, doesn't agree with me. And they get upset that I don't eat Romanian food. But then I figure out to say something, maybe I can have a bite or two to satisfy their giving, because they give this to you with their whole heart. So maybe I can have a bite or two and then, say thank you, food allergy, that's not for me. And then give them a hug, appreciate it. Show your appreciation for their giving, as opposed to feeling annoyed and stressed by them. Because oftentimes they give this to you because they're giving something, So then when you refuse it, they feel refused and they feel unappreciated. So that's also a good point to bring up. So when that happens, just say, thank you very much. I really appreciate it. Okay, I'll have a bite, or give me a dog. No, don't take a doggy bag and then throw it. And that's not a good. But express your gratitude for that. And if you express your gratitude and then keep on insisting, I said one more time, I says, okay, no, that's enough. Right?
We could do a whole episode or 2 or 3 or 4 on the psychology of eating, because that's extremely interesting. But yeah, food symbolically means so much more than just nourishment to many people. It's and we all learn that at Thanksgiving. If we don't go to the right people and have the right meals and do the right thing and do that, it's much more than I'm too full to eat. It's like a total rejection. So anyway, yeah, there's a very interesting, the world of food and the psychology of eating and the psychology of how food is presented to us is a whole nother thing, but it's so interesting.
Yes, and it is. And that is something I also brought up in my first book, Creating Ease at Life. And some people didn't quite like I brought this up, but it is important to know. And what's the purpose of food? Well, the purpose of food is fuel for energy. And then we just somehow, through evolution and civilization, we ended up making a big fancy meal, one fancier than another, and all kinds of fufu things next to the food, and might as well get a fanfare next to it. It's like, oh, here's food and celebration. Then the fact of the matter is that we can celebrate without ingesting, without eating or drinking some. We can still celebrate. And the number one, celebrating without eating or ingesting, is celebrate with a smile, celebrate with gratitude, show your gratitude to those you celebrate with, right? Yes, and if you think about it, many years ago, obesity was not a problem, and food wasn't causing as many issues in the physical body. Why? Because there wasn't as much toxicity back there. With all of the civilization, there's so much pollution, and now with all of the insecticides that thrown over the soil doesn't have the same quality as you used to have the same quality, and that all of the chemicals, they get absorbed into the soil, that it gets absorbed into the fruits, into the vegetables, into whatever the soil grows. So food is not as it used to be. And I remember back in 2007 when I switched my diet to a gluten-free diet, and I read about it. There was an explanation over why more people are gluten sensitive now as opposed to before, because the seed of the wheat, the gluten part of the wheat, it was bioengineered to produce more chewy type of a bread. And if you think of a French bread, that's more of a spongy type of a bread. The bread is not supposed to be as spongy as French bread or croissants. If you look back in history, that kind of bread didn't exist. So in order to have, well, here's where food started to be very fancy, right? Let's make it different. So this original seed that it was God, when God created the seed over here on planet Earth, it was not supposed to contain that much gluten. And so they altered the genes of the original wheat, and from like 20% of gluten, it ended up to be about 80% of gluten. And the thing about it is that the physical body doesn't know what to do with the protein. Gluten is a protein. So the body doesn't know what to do with it, and it will not digest it. So you introduce something that is not going to be digested, what do you think it's going to do? It's going to cause a lot of issues, right? So drinking alcohol, that's intoxication. That's poison. Well, if you drink a little bit of wine, it relaxes you, that's good. But, going and drinking a lot, and that's not good. Smoking, again, it's poisonous. So you poison yourself by doing those things. And then being not necessarily addicted to food, but you got to have that because it tastes good. Well, is it worth the symptoms you go through just because it tastes good? So it's good to know. It's good to know that a lot can be done, and managing it's what we need to focus our attention on, not necessarily on healing and solving anything, because a lot of conditions cannot be healed and solved because of the civilization, pollution, and so much stress we live with. It's a bit difficult, but managing it and managing well is the solution.
Yeah, and yeah, that makes sense. I think that's a good way to put it, actually. So anyway, interesting thing. I maybe next time we can talk about the way the food industry hypnotizes us without us realizing it to eat things that are not, sometimes are not, and I'm not knocking the food industry, but generally speaking, to eat things that are not good for us ultimately.
Oh, this just making profits. And even if you see fast food, that's a lot of fast food commercials, and the way they present these commercials, it triggers salivation. And then when you begin to salivate, the brain figures, well, you salivate because you're going to have food. And saliva has a lot of enzymes in it, and you need enzymes to digest the food. So when you see fast food commercial, just might as well close your eyes or turn the channel. That's just, you're right. It's not good. That's hypnosis. That's bad hypnosis.
Oh, it's being hypnotized without being aware of it. Hypnotized, because most people, if you say, do you want to eat food that harms you or is good for you? They're going to say, well, good for me. Well, then why do we eat so much food that's bad for us? And so it's really interesting. It's really interesting stuff. Some of the studies that psychologists have done about food and the attraction of food and the psychology of food are fascinating to me. I mean, they're just very, very interesting.
Well, definitely, it's a good topic of conversation to have on Wednesday night, and yeah, let's go that route next Wednesday.
Okay. Sounds good.
All right. So I think it was good for tonight, and we can talk about the psychology of food coming next Wednesday and the Wednesday after that.
And I hope everyone has a good bowel. Their bowels stay calm and non-irritated.
Yes. That's
When I worked with an older group of people once, group therapy. We met every day, and some of them lived in nursing homes, some of them lived in assisted living, and we met every day. And I would ask them, I'd come in, I'd say, "All right, how's everybody feeling?" "Oh, yeah, we're feeling good." Most people were. I said, "Well, who's been having good bowel movements lately?" "Oh, I have, Mr. Randy. I have." I love to talk about that. I say, "Well, that's good."
Important. It's very, very important because we need to eliminate. Very few people talk about it, but everybody eliminates. So, an elimination it's very important. So, yes.
So I hope everybody has a good elimination week.
Yes, let's eliminate the stress as well as much as possible. Toxic food and toxic people. All right. All right.
Okay.
Good night.